Hi, I'm Kirsten Gorsuch from Medtronic, the world's largest medical device company. Today I thought I'd share the part of the new Arthur Page model that has to do with creating authentic advocacy at scale. For most of our 50-year history, we've had the luxury of being able to focus on our core customer, the physician. But today, with an increasingly complex healthcare environment and healthcare costs that are spiraling out of control, we've had to focus more on additional stakeholders that have become critical to our success. In recent years, we've begun to establish reasonably good working relationships with a number of new constituents. That said, we sensed that we weren't getting as much out of these interactions as we knew that we could, so we set out to do better through a rigorous stakeholder engagement effort. This involved an enterprise-wide strategic initiative involving the identification, evaluation, and prioritization of key stakeholder interactions. Broadly, our goals for these engagements were to mitigate or neutralize the company detractors, convert those who were neutral to advocates, and empower those who were advocates to become company ambassadors. We started the process by compiling stakeholder inventories, which helped to inform and prioritize the groups most important to us. The inventories involved looking at a variety of different stakeholder groups and ranking them on their overall ability to influence, as well as their current favorability towards Medtronic. We cross-referenced these stakeholders with our key company platforms, such as innovation or global health stewardship, as well as the group's ability to influence. Having identified both the most relevant stakeholders and company platforms, we were then ready to orchestrate the engagements themselves. The actual engagements occurred in small group settings and included our CEO or a member of the senior management team. For example, our first engagement was with some of the most influential global health NGOs, including the World Health Organization, the World Bank, the International Diabetes Federation, the World Heart Foundation, and the Harvard School of Public Health. Through this transparent and candid dialogue, these normally skeptical groups began to embrace the role that Medtronic and the private sector could play in helping the public health community focus on chronic disease as the leading cause of death in nearly every country around the world. As a company dedicated almost entirely to chronic diseases, we wanted these groups and others in the public and private sector to view Medtronic as a leader and a partner. Through our authentic engagement, take a look at what others had to say about us. While we still have work to do to take advantage of some of the other elements of the Arthur Page engagement model, we've taken some important steps. If you're interested in learning more about our stakeholder engagement approach or in how we use the insights from these sessions to develop reputation programming, I'd love to talk to you more about it at the spring conference in March. I look forward to seeing you there.